Good morning, everyone. I'm very happy to be here with you all. And in my presentation, I will focus on the spatial configuration of the layout and to highlight how this configuration matters in the childbirth experience. And I will do that by talking about the research we carry out at the University of Florence within the Thesis Center, which is an inter-university center based at the Department of Architecture that studies healthcare and social healthcare building. Here you can see the research group, and also you have two QR codes. One for the website of the center, and the other one is a platform about researches that we have inside the Department of Architecture. Among them, also the maternity ones. I would like to begin my presentation by explaining where my interest in maternity spaces began. It all started here at the maternity at the Margherita Birth Center, where I had the opportunity to meet some fantastic midwives with whom I could talk, and I had the opportunity to visit a building that was very different from those I had always seen before. This is one of the 3 birth centers currently operating in Italy, and it is located in Florence. It is an alongside birth center located within the Careggi University Hospital, which you can see in the maps is a very big hospital, is a center of excellence for healthcare in our country. The birth center building is independent, recognizable by its circular shape, and connected by 2 corridors to the maternity building, where there is a traditional labor and delivery room, and rooms for the cesarean section, and maternity wards, and other gynecology department. And these corridors and this position allow any emergencies to be dealt with very quickly. This building has always struck me because it highlights the paradigm shift we need today to convey different concept of birth. And the change is evident in 2 aspects, the spatial layout and the internal atmosphere. The circular shape makes everything more welcoming, even though it is the most difficult shape for architects to design. Before moving on to the description of the spaces, I will start with the conception of the project. The early drawings of the building were made around the end of 1996. The peculiar design of the building emerged from the close cooperation between the obstetrician and researcher Marco Santini, whose work has focused on new model of care in large hospitals, and the architect Bianca Lepori. The project was then brought to fruition by the company that carried out the works and was completed in 2007. The layout concept can easily be traced back to Bianca Lepori's studies on spiral shapes. She said, the use of a spiral path while reshaping a setting can facilitate the perception of birth as an event that progressively evolves within a continuum. This ensures that the woman is placed at the center, enhancing her control of the process, in contrast with the usual arrow-like pathway of traditional hospital labor wards that reflect an assembly line approach to childbirth. Let us move now to the description of the layout. The building has 3 floors. The ground floor houses the staff changing rooms. On the first floor, there are the consultation rooms, a multi-purpose room for conferences and antenatal classes. And in the center, there is a swimming pool that is also used for antenatal classes. On the second floor, there are the birth rooms. Here is the plan of the second floor. The layout abandons linear schemes to focus on central space around which various functions run, distributed in a circular cloister shape. The center of the circle is occupied by the midwife station. There are 4 rooms, the pink one. There is also a space dedicated to the kitchen and one to the examination room, as well as a few other spaces for staff. The presence of a corridor in the outer ring of the circle allows for the creation of 2 different flows, one more public on the outside and one more intimate on the inside of the circle. The choice of an external corridor is very interesting. It is configured and used as a real extension of the room, of the birth room. It is used by women to move around in the early stages of labor and after birth. But it has also been designed for family members as a more public space. In fact, in some areas, there are games for children that play around. There is a bench, a beautiful natural light, and green and plants. The configuration of the birth rooms allows a direct connection both with the central space, where there are midwives, and also with the external corridor, making the space flexible for both private and social moments. The furniture of the birth rooms is home-like. The medical equipment is hidden within this furniture, and this brings the woman to feel safe without invasive monitors and machines around. Also, the bed is not a medical bed. The perception is both to being in a hospital, but at the same time in a welcoming and familiar space. Also interesting is the role of social spaces, or shared spaces we talked about the first day, such as the kitchen, made with modular tables, which in fact a place for meeting and exchanging knowledge between midwives, partners, women, and is a very used space. In the middle of the birth rooms, there is the compact space similar to a cloister where the midwife's desk is located. It offers a center of reference for women and at the same time for midwives and maternity care assistants. In general, the environment encourages relationships between users and midwife, creating a sense of identification and intimacy within a setting. This is quote is from the document, the report of the project by Bianca Lepori. The space available for labor is also interesting. Mothers are free to move around in several areas, rooms, corridors, and the central cloisters. This birth center has had very positive experiences from women who have given birth there. They are all collected in a book, the place, and here you can see some of them attached to the column, very beautiful way, but visiting these spaces several times and talking to the staff and mother was very inspiring for me, and led me to seek out other who were studying these things like me. So I started to study the work of Marilyn and the project of Marta, and so you can find, if you want to know more about the birth center, Margherita Birth Center, you can look at this paper, Optimal Setting for Childbirth, where there are more information about the birth center. So after that, I connected with some international networks, initially participating to the European Cost Action Birth, a research project led by Professor Sodown. And then together with the Midwifery Unit Network in Europe, I work on drafting the European standards for midwifery unit, and finally with the Global Birth Environment Design Network with Doreen Davis and Leeds, which is, say, the only network creating the field of architecture. I think this is very important because there are many networks born by midwives and other academics also, but in architecture is the only one, I think, is the right place where we can exchange and do something. So then my question was how to transfer international knowledge to my local context in Italy. So we started to support public health trust in Italy in the process of creating new birth centers. And I will talk about two research projects we carry out together in the hospital of Grosseto and in the hospital of Reggio Emilia. They are both public hospitals. Both the research led to the development of an architectural concept for two birth centers. The first one places more emphasis on the co-design process carried out with professionals during the briefing phase, which gave rise to the requirements for future projects. The other one emphasizes the impact of different types of layout, which then gave rise to guidelines to inform the design proposal. So the first one is the PISTA project. It was funded by the Tuscany region and involved the hospital of Grosseto and the company Do It, which deals with the design of sensory spaces. The Grosseto Hospital, which you can see in the picture, has recently been expanded with a new hospital, and the old building needed to be renovated to create a maternity and pediatric center on the 4th and 5th floor. The hospital involved our research center at the beginning in the briefing stage to support the development of architectural concept that will form the basis of the public tender. The objectives of the research were to investigate and define functional unit requirements, user needs and sensory technology significance, to create a design concept for a new layout distribution and a multisensory prototype, and to develop an inclusive co-design process. So we work closely with healthcare professionals, midwives, gynecologists, pediatricians, architects from the technical office of the hospital, and doctors from the health management. Together with them, we initiated a co-design process that lasted 2 years and led us to gain at the end the project strategies. We define functional units needs and the requirements, comparing provision and dimensioning in accordance with regional and national laws. We investigated user needs, focusing on health, perceptual, and psychological aspects of the different users. And we defined the sensory technology significance to be used in the design. In the end, we developed two concept design. One was a sensory prototype to support labor and birth. That was the topic of Alessia's presentation. And the other was the architectural concept of a layout proposal for the future maternal child center. So here you can see the actual layout on the fourth floor, where there is a mixture of obstetric and pediatric functions. So the idea emerged from the co-design process was that of create one floor dedicated to women and birth. So the functions were to be reorganized and renovated, including the addition of a space dedicated to the birth centers. So the final solution, after various layout options and discussions, is that there is a central and welcoming hub where all the flows converge and onto which the various areas open, so that women and their supporters and the family can see that there are different places where they can give birth and where someone will take care of them. We put antenatal rooms also, so women became familiar with the place also before birth. And we created an area for a birth center. It was not easy because you can see from the plan, we were working with an existing structure, one corridor, only a few square meters, and we offered to compromise in order to meet everyone's needs and offer all women the choice of where to give birth. Another important result of this research was the creation of spatial and sensory requirements to be included in the architectural concept documents. These requirements describe how to make the space more human and more suited to people's needs. These are 2 pages from the technical report showing the needs on one column and on one page, and in the other the requirements. The requirements are presented with the description of the requirement and the motivation, the reason why this requirement is important. And so, for example, we have the requirement, the layout should be in some way. Why? Because the continuity of care, or because the movement of people. So the person who read this document can be also informed about the importance to the factor of the layout and the consequences of their creation. Bear in mind that these documents form the basis of the tender, and will therefore be read by all designers who will proposing a construction solution. So I think this is a very important thing, because it is a way to transfer in knowledge from research to practice. And this also reminds me the question of Sarasvati, who should inform birth space design. And so I think this is an open question for me. And also Marilyn yesterday showed another way to inform the birth space design. Anyway, I think it is a point that we can think about. The sensory prototypes aims to support labor and birth by stimulating the senses and movement. And it is designed to be installed in rooms that cannot be transformed. You can find it illustrated in more detail at the exhibition. So the second research project concerns the MIRE project, Here we have the Health Trust of Reggio Emilia Hospital, and also psychologists from the University of Genova and staff from Margherita Bersente participated in this research. There were here two objectives. One, to study the relationship between environmental factor and the perception of woman and midwife in two different settings in order to consolidate certain findings. On the other hand, to give a distinctive character, identity, a new identity to the birth center that the hospital is going to realize in the maternity center. So the starting point for this research was to verify the study we carried out on the 8 building spaces that are crucial on the design of birth environment, which are built on previous studies I mentioned before. We then used them as a guide both to consolidate the evidence and to also to guide the design. To meet the first objective, we used the spatial analysis method, such as space syntax, to read the properties of the layout, together with perceptual surveys on mothers and midwife, comparing two different settings. You can see the plans. One is Margherita Birth Center, and the other one is another traditional obstetric-led unit. We then created an ad hoc questionnaire to survey users' perception of these 8 elements. And this table shows how we arrived at the design of the new tool, because we wanted to compare a spatial parameter, quantifiable parameter, with user perception obtained through specific questions. However, there is no time today to discuss this, so there is a paper here that you can find the result of this survey. Now I would like to talk about the layout of the proposed project and how we came up with it. As you can see in this image, the hospital already had a project done by the architectural firm that won the tender for the entire building, but the hospital was not satisfied about the birth center area, which is on the left, and because it's treated like the rest of the rooms, maybe just changing the furniture inside. And so maybe this is the proof that there is a lack of knowledge on optimal birth setting for our colleagues. And so we started by looking at the critical factors in the designer proposed plan, and based on 8 elements we had studied. In particular, we found the possibility of interference in the flow of people due to the position of the entrances, and the fragmentation of the workspaces for the midwives, that is negative for the model of care, for the communication. And the lack of a buffer zone that communicates a different atmosphere, a calm atmosphere, and the unclear function of social spaces, that they are dispersed in the plan and not favoring the communication between different users. And then other things about storage and so on. And finally, there was the issue of the configuration of the birth room, which is an elongated shape, which offers less space for movement the bed is in the center of the room, and the furniture are very appropriate. And also there is a problem about light because the windows are like this one, they can not open, and so is a problem. So we developed an initial proposal, which we then submitted to the hospital, in which we attempted to break the standardization of delivery rooms by changing their shape and introducing curved line. At the same time, our study of perception led us to develop guidelines that we followed to improve and optimize the space and the design final solution. And the challenge was to work with a fixed supporting structure and technical system in a defined position. So we exploited the constraints, for example, the position of the pillars, to create new spaces. So this led us to the final proposal. I will briefly describe the key point. Here you can see the colors represent the colors of the floor, and they derive from the color of the city of Reggio Emilia. And mainly we divided in two areas the layout. The first one more social and public, and the second one dedicated to the birth rooms, and so more calm and private. We concentrated the social spaces at the entrance in one space that has a kitchen and a space for relax. And we pay attention to the transmission of philosophy of birth at the entrance. So the first things people see when entering the birth center is the social space, so is the space of the community. And also there is a wall here where there will be strong messages about positive birth. The right part is dedicated to the 5 birth rooms and is calmer and without noise. That was a request from women and midwife, and without flow interference because we closed one of the entrance at the previous door. Here you can see also the pillar of the structure that we incorporated inside some space like this is for the supporters or for the family to rest, and outside the room, and also there are spaces for the storage. The position of midwife desk is located in a center between the two areas, and this is important because they can participate both to the social and private moments, and also the desk is visible when you enter to the space. We added also a support space for the staff. There was not in the previous proposal. And an important thing I think is that with the same square meters we optimize the functions and the dimension of the room. So for example, we added a lot of storages that are always needed, and also the square meters of birth room are very different, and we concentrated the social space in one space, so we get place for a new playground for children, a children area, and also the staff rest area. The birth room has a shape that is square and not elongated, and the furniture are very flexible inside, and there is a space, the entrance. The curved line can create a more intimate space because before enter to the room, and also there is a distance between the door and the room. So more privacy for people. So this is the result which show us how it's possible to do something different if you have the knowledge to do it with the same cost and the same space. And this also is why I think it's so important to consolidate evidence and transfer knowledge to the architects who design. And I think with the GBDN network and our project, we are trying to do something on this regard, but it's not still finished. So we have the exhibition, the website, the colloquium, but more to come. And so thank you.